Just want to give a quick clinical case study. This is Dr. Jen from Gradual Health Integrative. We had a woman in her mid-50s who is coming to visit us. She has complaints of gradual weight gain. She feels as though even though she's dialed in her diet and her exercise regime, she just continues to gain, and that's affecting her mental health. She also feels as though her hormones may be depleted. She's having some symptoms of perimenopause and menopause. So what we do here at Cardea is we cast the net very wide when there's complaints of weight, sluggishness, mood concerns. We look at neurotransmitters. We do a very deep dive into thyroid health, and that includes the endocrine system as well as is there any autoimmunity going on against the thyroid. We take a deep dive into any food allergy issues or sensitivities. Is that what is holding on to inflammation for you? And we also do saliva hormone testing. So blood testing is quite limited with hormones because we know women's hormones are changing from dawn until dusk, Monday to Wednesday to Friday, from day 1 to 15 to 30 of your cycle. And so our saliva test gives us a graphic representation of what's happening throughout your entire cycle. The primary points we look at are during ovulation, premenses, during your menstruation, and after. And oftentimes we're able to really pinpoint when you might need prescriptions. If we do prescriptions, we do bioidenticals, which we get through a compounding pharmacy. So the pharmacist makes hormones that are customized for you and your needs, but we also customize them for during your cycle and what's happening during your cycle. Some people just need a little support just before menstruation if they're having mood concerns, bloating concerns. Of course, everybody is unique in their presentation. But we also dive deeper into neurotransmitters and also micronutrients that support all of our glands, from our adrenals to our thyroid. We look particularly at B12 levels, sometimes B6, vitamin D. We look at ferritin, zinc, selenium, and oftentimes even iodine. And we can run some neurotransmitter tests as well. And so once we find out exactly what you're deficient in or just not optimized in, we replace those. And so we look at the human body. Oftentimes we take better care of our vehicles than we do our own body. We would not put diesel fuel in a Lamborghini. We would not suffice with old oil or low transmission fuel, but oftentimes a lot of these tests aren't even run. And if they are, they tend to be acceptable at a low level. And we really look at optimizing the human body so that you can live life with vigor and be the best version of yourself. So if this sounds like you, or you've struggled at all in the past couple of years, I encourage you to look into functional medicine. There's a lot of doctors that are pioneers in functional medicine. Dr. Mark Hyman, Dr. Will Cole. There's many out there. They have wonderful podcasts. I encourage you to find a provider that is certified so that they can do a physical exam, they can order blood work, they can prescribe if needed, and that they have robust training in functional medicine. IFM is a great one. I'm certified in IFM as well as A4M. And so if you're interested, take a look at the IFM website and look for a practitioner near you. Ask the right questions, ask to see their certifications and their CV, and make 2024 the year where you are feeling your best and you know the magic numbers that you need to follow every 4 to 6 months so that you are feeling your absolute best from a mental health perspective, from a physical health perspective, that your endurance is where it needs to be, brain power, mood, sleep, lifestyle, all the things, and nutrition. So if you're interested in learning more about us, we are in East Aurora, New York. We have a beautiful compound out here on 80 acres of land. We are at www.cardeahealthwny.com. We would love to meet you. Have a beautiful new year.